Well, Gary, basically the last year has been an interesting one. I think probably would be a fair word for it. You've been tested in a lot of different ways, and at the same time, you've come out and been very, very good. But it sounds like you're wanting to share the message here. Tell us a little bit about the cancer event that you're going to be attending in at St. Luke's in Cedar Rapids next week.
First off, Brent, it was a year ago, May 28th, that I got that phone call announcing, or from the urologist telling me I had prostate cancer, and I must say that was a shock. And I'm certainly not a martyr for the affliction, but it wasn't, by most accounts, an aggressive, egregious cancer. All cancers are serious, but the bottom line is you have to hit it head on and go after it and be as aggressive as it might be. And we did that. And 42 radiation treatments later, I'm declared cancer-free. It might be something else tomorrow, but one thing it's taught me that every day is a blessing. And, you live it one day at a time. You certainly plan for the future, but nothing's guaranteed. And so that's kind of the attitude I had. It was really important to me that I not interrupt my regular routine of Iowa football and basketball, coaches' shows, within reason. Take care of yourself physically, get enough rest, all those wonderful things. And I must say that Lady Luck, good Lord, whatever you want to call it, was sitting on my shoulder, because other than fatigue from time to time, I had no issues, no major side effects. So I'm very thankful for that. And so. Fast forward a year later, and I'm just urging guys that are, 40, 45 and above to have that simple blood test done, that PSA test. It's 5-minute blood work, and it'll tell you whether or not you're either a candidate or there's something amiss. And, I'm doing regular checkups simply because the issue in the Dolphin family was always the heart. Nowhere was there any cancer in my immediate family. And but because of the regular checkups, they were able to find the prostate cancer, and so I'm very thankful for that. So in a couple of weeks on Monday night, I believe it's June 18th, I'm going to be giving a talk at St. Luke's Hospital there in Cedar Rapids with some of the cancer doctors in attendance. I'm really looking forward to it. I know they do wonderful work at St. Luke's, as they do at Mercy there in Cedar Rapids, and you have wonderful medical facilities, let alone cancer facilities, either being constructed in the neighborhood, Cedar Rapids, or existing. And so it's well worth the time invested to be aggressive, to be proactive in the preventative mode before cancer ever strikes. And therefore, if it ever does, you're already ahead of the game. So we'll be talking about that. I'll be talking about my journey over the last year and answering questions, and look forward to it.
Gary, you're going to have a doctor there from the Physicians Clinic of Iowa. I think Jonathan Rippentrop is his name. He's going to be able to give a little bit more information about the process and everything. But explain what a PSA is for those people that may not know, because I think there's a misconception out there that this is some big, long process that you need to go in and to get tested for. And as you said, it's about a 5-minute process.
Yeah, it's nothing abnormal at all, Todd. It's like normal blood work. Whether it's they're looking for your cholesterol count or they're checking your blood pressure, it's no more than a needle in the arm, and they draw to a couple vials of blood, and 3 days later they call you and give you the update. The PSA count is. I think it's the acronym for prostate-specific antigen, and it simply is the litmus test for whether what your PSA is. And mine, as an example, was in the neighborhood of 2.5 to 3, 2.6 to 2.9, and it doubled to more than doubled to 5.8 or 5.9, just below 6. And that was the red flag that went up. And from there, we had a simple biopsy done. And that's where they found the tumors. And I elected to go with the radiation over the surgery. And I bring that up because Dr. Jonathan Rippentrop is one of the foremost surgeons in the state of Iowa. He's done hundreds of the prostate surgeries. And, don't believe that garbage that was on the news a couple of weeks ago as some committee out east that decided the PSA test was overused and overblown and not worth the time. To my way of thinking, nothing could be further from the truth, particularly from a group of medical folks who don't even deal in prostate or prostate cancer. I think it's a lifesaver. Now again, I've got a story to tell, so I'm here to endorse the PSA test. But it really is a simple, nobody likes a needle, but it is a simple test, and the nurses or the nurses' aides are so doggone good at finding the vein and causing very little, if any, pain that it's a simple process, and I urge all males to have it done.
Again, we are speaking with University of Iowa play-by-play voice of Gary Dolphin. On the line, he's going to be in Cedar Rapids coming up on Monday, June 18th from 6:30 until 7:30 at the Kirkwood Training and Outreach Center. Again, a community event talking about prostate cancer, and Gary's going to be the featured speaker. Gary, it's one thing to go in for the test, but when the doctor gives you the diagnosis, I guess your response, were you numb? Did it hit you like a sledgehammer? Were you ready to say, okay, what's it going to take, and let's get started?
I think it was all of those, Brent. It certainly was a punch in the gut when, and I can still remember the exact quote from my urologist. He said, well, Dolph, I don't know how to tell you this, but you have prostate cancer. That was the exact quote, and I thought I was prepared for the worst, but you never really are once you hear those words. Again, there's no history of cancer in my family, which I think illustrates that cancer knows no specific victim. It is non-discriminate when it picks on male, female, black, white, Indian. It doesn't matter. It's just a group of genes that all of a sudden abnormally get out of whack. And who knows how they turn bad, but or a group of cells, I should say. Hopefully there's enough good cells to fight off the bad cells. But the treatment that is available today, which is very non-invasive, and we'll talk about that in a couple of weeks, is just incredible to me. But that said, I went from a punch in the gut to numb to, okay, what's the next step? What do we do? And keep in mind, my particular prostate cancer was non-aggressive. I mean, if you leave it go, it would get you in time. But I probably could have waited a year or two before I decided to do anything. But that's just not in my persona. I wanted to get out ahead of it. I obviously, by virtue of what I do, I've got some advantages in that I know a lot of great doctors in Dubuque and Eastern Iowa and around the state, and certainly had many of them reach out to me when the announcement was made. And so I had an advantage that maybe some people don't have, but that doesn't mean you don't go get the treatment, because the treatment's right down the street from you. There are many great cancer centers all over the state, most notably at the University of Iowa, but Mayo Clinic's not that far away, depending on the severity. And so it was all of those, Brent, and I pursued it right from the get-go. I talked to a lot of tremendous doctors at Iowa and around Eastern Iowa, and then made the decision to go with the radiation. And as all doctors, surgeons, radiologists, those that distribute other forms of cancer treatment would tell you, there is no wrong decision. Ultimately, it's up to you as to how you want to treat it. But just gather up all the information with the internet and online now. You can certainly educate yourself. But I had great doctors, great people around me, and I'm forever grateful.